Hi guys, my name's Christy. Thanks for joining me today. And I have some good news and I have some bad news. So I'm going to start with the bad news. The bad news is you're going to die. And you're probably going to die of one of four lifestyle diseases, and that's heart disease, Alzheimer's, diabetes, and cancer. Most of us will die of one of those four diseases. Now, the good news is you have control over your health. So you can take control of your health and mitigate the risk of getting one of those four diseases. Now, not only can you mitigate the risk, but you could also mitigate the possibility of getting one of those four diseases earlier than you would like. So really the whole goal is, can I incorporate lifestyle behaviors to push back the age at which I might get one of the four killers: diabetes, heart disease, Alzheimer's, or cancer. If I could just get it much later in life, let's say 120, then I think we all agree that that's a big benefit. So what I want to talk about today is one way. There are many lifestyle habits that you could incorporate that will mitigate your risk of those four killers. But one I want to talk about today is managing your blood sugar, or otherwise called blood glucose. So how do you do that? One of the ways to manage our blood glucose is by the foods we eat. So eliminating or greatly reducing. How about greatly reducing? Reducing the amount of sugar and complex carbohydrates, which would be breads, pastas, rice, those sorts of foods, as well as processed foods. So not necessarily eliminate. Let's not say eliminate, but let's just say reduce. Reduce the amount of foods, of those complex carbohydrates, the sugars, the breads, the pastas, and the processed foods. If you look at a label, of any of those foods, you're going to see that there's a lot of carbohydrates and a lot of sugar. So when we eat those processed foods, those complex carbohydrates, as well as the simple sugars, our blood glucose is going to go up. Our body then has to release insulin to pull the blood sugar into our cells. It'll first be pulled into our liver and our muscle cells to be stored as glycogen. However, if those storage tanks in the liver and the muscle are full, then it's going to be stored as fat. So you're going to like this part of it, and that is, if you can manage your blood glucose, you can also manage your weight. Weight gain is greatly reduced if we're managing our blood sugar, if we can reduce those spikes. And like I said, first way, we can reduce the spikes by choosing the right foods. Foods that have no label. Foods in the produce section, lots of vegetables. Vegetables have no label, and you can eat lots of them. Vegetables in themselves are carbohydrates, but they also carry a whole lot of nutrients with them. That's why that's a big bang for your buck. You're going to get a lot of ROI on the vegetables that you eat. So that's their first step. Second step is you can exercise. So exercise will help use those stored glycogen in our liver and in our muscles. So exercising helps us manage blood glucose. Another thing we could do is sleep really well. Make sure you're getting plenty of sleep. That also helps manage blood glucose. Another thing you could do is simply measure it. And I do measure my blood glucose, and I also measure my blood ketones. And I do it with this keto meter. Anyone can get one. They're not that expensive. You prick your finger, and you can just measure with a small drop of blood. So there are many ways that you can, on this video, I'm just talking about blood glucose, but that you can begin to manage it. And probably the easiest for most people is choosing the right foods. So it's really free, right? We can just choose to eat more vegetables and be intimately aware of what the label says if we're choosing a food with a label. So thanks for watching today. I appreciate it. My name's Christy. My website is wiseandwell.org, wiseandwell.org. Please check it out. I also have some links to articles that pertain to managing our blood glucose. It would be a great improvement for all of us to take that seriously. Thanks for watching.